An attending once told me that every surgeon has a little graveyard in the back of their mind, a place where they store the patients they couldn't save, the cases that went wrong, the people who haunt them. And he said it like it was normal, like it was just part of the job, like we should all accept that we're going to carry dead patients in our heads for the rest of our lives. And nobody talks about this. Hello, I'm Dr. Felix Boecker, and today we're talking about the trauma of medicine. The trauma we experience, the trauma we carry, the trauma we never process. Welcome to In Search of 42. Here's what they don't tell you in medical school. Medicine is traumatic, not just for the patients, but for the physicians as well. You will see things that will haunt you. You will lose patients you desperately wanted to save. You will make mistakes that harm people. You will watch people die. Children, young adults, parents, people who should have lived. And you will carry that trauma with you for years, for decades, for the rest of your life. And nobody will teach you how to process it. Nobody will give you time to grieve. Nobody will ask how you're feeling. Because there's another patient coming through the door. Because you have to be strong. Because you have to keep moving. So you compartmentalize. You tuck it away. You store it in that little graveyard in the back of your mind. And you pretend you're fine. Until one day, you are not fine. Until one day, it all comes flooding back. Until one day, you realize you've been carrying trauma for years and you never processed any of it. Today, I want to tell you about my graveyard, the patients I still think about, the cases that haunt me, the trauma I never processed. And I'm going to tell you what I have learned about actually processing it, about giving yourself permission to feel, about being human in a profession that demands you to be superhuman. Because we have to start talking about this. We have to stop pretending we're not affected. We have to stop glorifying emotional suppression. And we have to start processing the trauma. Let me tell you about the patients I still carry, the ones who live in that graveyard in the back of my mind. There's the 16-year-old who was shot by his friend. They were having an argument on his front porch. 16-year-old boys, and one of them pulled out a gun. 16-year-olds solving arguments with weapons. He died. Too young. Way too young. I still think about him. About the senselessness of it. About the waste. About his parents. About his future that never happened. There's the 19-year-old who finally succeeded at suicide. She had tried multiple times, and this time she succeeded. Her parents knew this day would come, but they wanted her organs to be donated. They wanted her life to matter. They wanted something good to come from this tragedy. She was so young. Her organs could have saved multiple people. But she coded multiple times throughout the day, waiting for potential recipient matches. And in the end, her organs were never harvested. Nobody got a second chance at life. Her death didn't save anyone. It was just a loss, pure loss. I still think about that, about her parents' hope, about their desire for meaning, and about how even that was taken from them. The 40-year-old who drove drunk into a tree, another wasted life. His brother was a pastor at a local church and very understanding of the situation, very gracious, very kind, but still another life wasted, another family destroyed, another person who could have gotten help but didn't. There's the woman in her 40s with a bowel obstruction. She was my patient as a chief resident, and I was responsible for her care. She presented with a bowel obstruction, and everyone assumed it was due to a lymphoma that was being worked up. We operated on the bowel obstruction, and the pathology came back surprising: metastatic breast cancer. Completely missed. She died in the ICU 3 months before her oldest child graduated from high school. 3 months. She was a lovely lady, and I think about her kids. I think about my own kids. I think about wanting to see them graduate from high school. She didn't get that, and that still haunts me. Another one of my chief patients had a recurrent inguinal hernia. What was supposed to be an easy case, a routine case, a general surgery case. But it went wrong. He lost one of his testicles. He had a large, open, gaping wound in his groin that never fully healed while I was still at Abington. I feel like I failed him in many ways. Even though I had an attending surgeon overseeing my entire care, I still feel like I failed him. These are the patients I carry in that graveyard in the back of my mind. And there are more, many more. But these are some of the ones that resurface most often, the ones I think about, the ones that make me sad, the ones that make me question whether I could have done anything differently. Let me tell you how compartmentalization works, because this is what we're taught to do implicitly, not explicitly, through modeling, not through instruction. You have a traumatic case. A patient dies, a surgery goes wrong, a child codes, whatever it is, and you feel something: sadness, grief, guilt, fear, horror. Whatever the emotion is, you feel it for a moment, and then someone pages you, or the next patient arrives, or the attending asks you a question, and you don't have time to process the emotion. You don't have time to sit with it. You don't have time to grieve. So you do what you've been trained to do: you tuck it away. You put that patient, that case, that emotion into a little box in your mind. You store it in the back somewhere, in that graveyard, and you move on to the next patient. You give them your full attention. You focus on what needs to be done. You keep working. And most of the time, you end up forgetting about those boxes. They sit there, stored away, unprocessed, until they resurface. Sometimes years later, sometimes triggered by a similar case, sometimes triggered by something in your personal life, sometimes for no reason at all. They just come back, and you feel it all over again. That's compartmentalization. It's a survival mechanism. It allows you to keep functioning. It allows you to keep working. It allows you to take care of the next patient. But it's not processing. It's not grieving. It's not healing. It's just storage. And eventually, those boxes pile up, and the weight of them becomes unbearable. Let me tell you about the culture that creates this: the culture of surgery, the culture of medicine, the culture of toughness. When I was in residency, an attending told me about this graveyard in the back of the mind. He said, every surgeon has one. He said it matter of fact, like it was inevitable, like it was just part of the job, like we should all accept that we're going to carry dead patients in our heads forever. And nobody questioned it. Nobody said, maybe that's not healthy. Nobody said, maybe we should process these deaths instead of storing them away. It was just, this is how it is, get used to it. That's the culture. Not processing, not feeling bad for people dying, just moving on. because life moves on, because more patients are flooding through the door. I really didn't have time to process, debrief, and grieve all the lost lives. There were times when I would break down in my office, behind closed doors, after a full call shift, because it was simply too much, and no one wanted to talk about any of it. But I couldn't break down in public. I couldn't show emotion in front of my team. I couldn't show weakness, because the culture in surgery is one of toughness, not weakness, not having emotions, not being affected by death. If you are affected, you are weak. If you grieve, you're not cut out for surgery. If you cry, you don't belong. That's the message. And so we all learn to suppress, to compartmentalize, to pretend we're fine, even when we are not. Let's talk about morbidity and mortality conferences, M&M for short. These are held in academic surgery programs, usually every week. The purpose is to discuss cases where there were complications or deaths, to review what happened, to discuss what could have been done differently, to learn from mistakes. It's supposed to be educational, and it is, for surgical technique, for clinical decision making, for systems issues. But there's no space for emotion. The format is purely about the surgery and the care provided. Nobody ever seems interested in the emotional aspects of the care provided, not at any of the institutions where I attended M&M conferences. You present the case, you discuss what went wrong, you analyze the decision making, you talk about alternative approaches, maybe you get grilled by other attendings, sometimes harshly, sometimes publicly humiliated, but nobody asks, how do you feel about this patient dying? Nobody asks, what has this been like for you emotionally? Nobody asks, are you okay? It's all technique, all clinical, all intellectual. There's no room for the human cost, no room for grief, no room for processing trauma. And so we learn the only thing that matters is the medicine, not the human being delivering it, not the emotional toll, just the technique. Let me tell you what it's like when patients keep coming in, when there's no time to process. You're working a trauma shift. A 16-year-old comes in with a gunshot wound. You do everything you can. You operate. You try to save him. He dies on the table. And while you're still closing, while his blood is still on your gloves, you get paged. Another trauma activation. This time, a car accident, multiple victims. You have to go right now. So you finish closing. You strip off your gloves. You take a breath, maybe, if you have time. And then you go to the next patient. You tuck the 16-year-old into a box in your mind. You store him away and you focus on the car accident victim because they need you, because you have to be present, because you have to give them your best. And this happens all night long, case after case, patient after patient, trauma after trauma. And there is no time to process any of it. No time to grieve, no time to feel. You just keep tucking them away. Keep storing them in that graveyard. Keep moving forward until your shift ends. And you go home, exhausted, depleted, carrying a dozen new boxes in your mind that you've never opened, that you've never processed, that you will carry forever. Collecting dust in the back of your mind. The cobwebs of trauma. Here's what nobody tells you. The cumulative effect is worse than the single events. If it were just one traumatic case, you could process it. You could grieve. You could work through it. But that's not the case. It's hundreds, over years, over decades, and they add up. Each box you store away adds weight. Each patient you compartmentalize adds to the burden. And eventually, You're carrying so much that you can barely function. You don't even realize that it's happening because it's gradual, because each individual case seems manageable, because you've been doing this for so long that it feels normal. But it's not normal. It's not healthy. It's not sustainable. And one day, something triggers it. A case that's particularly bad, a personal loss, a moment of vulnerability, and everything comes flooding back. All those boxes you stored away, all those patients you never grieved, all that trauma you never processed. It all comes back at once. And then you realize, I've been carrying this for years, and I never dealt with any of it. That's the cumulative effect. Let me talk about the gentleman with the hernia repair, the one where things went wrong, where he lost a testicle, where he had a wound that wouldn't heal. I feel like I failed him, even though I had an attending surgeon overseeing my entire care, even though it was a complication, not necessarily an error, even though these things happen sometimes despite our best efforts. I still feel like I failed him. That's the impossible standard we hold ourselves to. We're supposed to be perfect. We're supposed to save everyone. We're supposed to never make mistakes. We're supposed to never have complications. And when we inevitably fail to meet that impossible standard, we blame ourselves. We carry guilt. We carry shame. We carry the belief that we're not good enough. This is how I was trained. This is how I was conditioned. To hold myself to a standard that no human can meet, and to punish myself when I fall short. If a resident came to me with a similar outcome, I would tell them, you did everything you could. Complications happen. You are human. You are not a failure. But I cannot give myself that same grace. None of us can, because we've been conditioned to believe that anything less than perfection is failure, and that's destroying us. I didn't start processing any of this until years later, years after the cases happened, years after I stored them away. In 2024, I took a sabbatical the entire year. I lost my brother, I lost two of my best friends, all within a few months, and I needed time. Time to grieve, time to process, time to heal. And during that year, all those boxes I had stored away started to open. The patients I had tucked away started to resurface. Sometimes spontaneously, sometimes in therapy sessions. But I finally had time to think things through clearly. I finally had space to feel. I finally had permission to grieve. And it was necessary, essential, overdue. I worked with my therapist. I cried. I felt sad. I felt guilty. I questioned whether I could have done anything differently. I sat with all the emotions I had suppressed for years, and slowly, gradually, I started to process. Not all of it. You never fully process it all because there simply is too much of it, but those patients still live in my graveyard. They still resurface from time to time, and now I can sit with them. I can feel the grief without being overwhelmed by it. I can acknowledge the loss without falling apart. That's what processing looks like. Not erasing the memories, not making the pain go away, but learning to carry it in a way that doesn't destroy you. Here is what we should teach in medical school and residency: grace. Grace for being human, grace for having emotions. Surgeons and physicians are not robots. We have emotions. We must accept them, learn about them, learn about ourselves, process them, understand them. We are humans in a human centric field of work. Emotions will come up. To pretend they don't is bullshit. To pretend emotions don't affect us is bullshit too. We need to teach that it's okay to grieve when a patient dies, that it's okay to feel sad, that it's okay to be affected, that being affected doesn't make you weak, it makes you human. And being human is what makes you a good doctor. We need to teach how to process trauma, how to debrief after difficult cases, how to support each other, how to create space for emotion. We need to teach that the graveyard in the back of your mind is not inevitable, that you don't have to carry unprocessed trauma forever, that there are healthier ways to cope. We need to teach self compassion, grace, forgiveness for the mistakes we make, for the patience we lose, for being imperfect. This should be part of the curriculum, not an afterthought, not optional, but essential. Because if we don't teach physicians how to process trauma, they will carry it forever and it will destroy them. When I mentor medical students and residents nowadays, I do something that no one ever did for me. When they experience a difficult case, when they lose a patient, when something goes wrong, I ask them, how do you feel about it? That's it. That simple question. Nobody ever asked me that. Not once in my entire training. Nobody was interested in how I feel. Nobody cared about my emotional response. Nobody gave me space to process. And I think that changed me. I think it made me close off. I think it made me suppress my emotions. I think it made me disconnect from my feelings. And that hasn't just affected my medical career, it's affected my romantic relationships too. I've always been closed off, not in touch with my own emotions, unable to express what I'm feeling, unable to be vulnerable. And that has contributed to 2 divorces. That has made relationships incredibly difficult. Because I learned early on emotions are weakness, emotions are dangerous, emotions should be suppressed. And that carried over into every aspect of my life. So, when I ask my students and residents, how do you feel about it? I'm giving them something I never got. I'm giving them permission to feel. I'm giving them space to process. I'm acknowledging that they are human, that they have emotions, and that those emotions matter. I acknowledge their emotions and feelings. I allow them space to debrief and process anything and everything they have seen, witnessed, or participated in. Losing a patient is never easy, nor should it be. We are humans, we have emotions, and we should care about the patients we attend to. That caring, that grief, that sadness, that's what makes us good doctors. Not suppressing it, not compartmentalizing it, not pretending we're unaffected, but feeling it, processing it, honoring it. That's what makes us human. So, how do you actually process trauma? How do you open those boxes you've stored away? How do you grieve the patients you've lost? Here are some things that I have learned. Step 1, give yourself permission to feel. You are allowed to be affected. You are allowed to grieve. You are allowed to be sad. You are allowed to cry. That's not weakness, that's humanity. Step 2, find a safe space to process. Therapy is essential. Find a therapist who understands trauma, who understands the unique pressures of medicine, who can help you process without judgment. You cannot do this alone. You should never do this alone. Step 3, talk about it with your therapist, with trusted colleagues, with friends, with family. Do not keep it locked inside. Do not suffer in silence. The more you talk about it, the more you process it. Step 4, allow time for grieving. This doesn't happen overnight. You cannot process years of trauma in one therapy session. It takes time, months, years, and that's okay. Be patient with yourself. Step 5, practice self-compassion. Stop holding yourself to impossible standards. Stop blaming yourself for things beyond your control. Stop punishing yourself for being human. You did the best you could with the information you had and the resources available to you. That has to be enough. Step 6, connect with your emotions. If you have spent years suppressing your emotions, you have to relearn how to feel. And that's hard work. It's uncomfortable. It's scary, but it's necessary. Work with your therapist on this. Learn to identify what you're feeling. Learn to sit with uncomfortable emotions. Learn to express what you're experiencing. Step 7, create rituals for honoring loss. Some physicians keep a journal. Some write letters to patients they've lost. Some have a private memorial. Some practice gratitude for the patients they have known. Find something that works for you, something that allows you to honor the loss, to acknowledge the grief, to remember without being consumed. Step 8, support each other. Find colleagues who get it, who are willing to talk about the emotional toll, who will debrief with you after difficult cases, who will check in on you. Create a culture of support within your team. Be the person who asks, how do you feel about it? Be the person who makes space for emotion. Be the person you wish you had during training. If you're listening to this and you're carrying trauma, here's what I want you to know. It's not too late to process it, even if it's been years, even if it's been decades, even if you've carried it for your entire career. You can still process it. You can still grieve. You can still heal. It won't erase the memories. It won't make the pain disappear completely, but it will make it bearable. It will allow you to carry it without being destroyed by it. And you deserve that. You deserve to heal. You deserve to not carry unprocessed trauma around forever. You deserve grace. You deserve compassion. You deserve to be human. So please get help. Find a therapist and start talking about it. Start processing. It's hard work. It's painful work, but it's worth it. Because you cannot keep carrying this alone. You cannot keep suppressing it. You cannot keep pretending you are fine. Eventually, it will break you. So, deal with it now. Process it now. Heal now before it's too late. If you're a medical student or a resident just starting out, here's what I want you to know. You will experience trauma in medicine. That's inevitable. You will lose patience. You will see terrible things. You will be affected. But you don't have to carry it alone. You don't have to suppress it. You don't have to create a graveyard in your mind. There's a better way. Process as you go. Debrief after difficult cases. Talk to someone. Your co-residents, a mentor, your therapist. Don't wait for years to deal with it. Don't wait until you're drowning in unprocessed trauma. Deal with it in real time, as it happens. That is much healthier. That is much more sustainable. That's what will allow you to have a long career without getting destroyed. And find mentors who care about your emotional well-being. Find attendings who ask, how do you feel about it? Find people who model healthy processing. Find people who acknowledge their own humanity. Those are the people you want to learn from. Not the ones who brag about never being affected, not the ones who glorify suppression, not the ones who pretend to be robots, but the ones who are honest about the toll, the ones who process their emotions, the ones who take care of themselves. Those are the role models you need. I have a graveyard in the back of my mind where I carry those patients I couldn't save, cases that went wrong, people who still haunt me. The 16-year-old shot by his friend, the 19-year-old whose organs were never harvested, the mother who died before her son's graduation, the gentleman whose hernia repair went wrong, and many more. They're still there. They will still resurface from time to time. They will still make me sad. But I've processed most of it for now, through therapy, through time, through permission to feel. And I can carry them without being destroyed by them. And that's what I want for you. Not to erase the trauma, not to pretend it doesn't exist, but to process it, to grieve it, to carry it in a healthy way. Because you will experience trauma in medicine. That's inevitable. But you don't have to let it destroy you. You can process it. You can heal. You can be human. And being human is what makes you a good doctor. This is In Search of 42. I'm Dr. Felix Boecker, and it's okay to be affected by what you see. It's okay to grieve. It's okay to be human. In fact, it's essential. If this episode resonated with you, hit that like button and subscribe. And leave a comment about your experience with trauma in medicine. What cases do you carry? What helps you process? What do you wish someone had told you? And if you're struggling with unprocessed trauma, please get help. Find a therapist and start talking about it. You don't have to carry this alone. Take care of yourselves and each other. Let me know what you want me to cover next, and I will see you in the next episode.